Namaste. Thank you, Priyaji. I'm absolutely delighted to introduce Hindu Medical Association to you all. In this virtual program, we can't have a fanfare or a welcome reception with snacks and drinks, but we wholeheartedly welcome you all today to the launch of the Hindu Medical Association and look forward to a time when we can meet in person. Today's launch event is a significant moment, as it's the first national organization of its kind representing Hindu healthcare professionals and has been the result of a dedicated committee of Hindu doctors working together to deliver this metaphorical baby into the world. And just for the record, as an ENT surgeon, I was very glad that this was a metaphorical baby, as my midwifery skills are long forgotten. Now, just yesterday, I was at a party for my son and his school friends to celebrate finishing their exams. On this occasion, however, we parents weren't just chauffeurs dropping the kids off, but we were also invited to share in the celebrations. So I met many other parents for the first time. And one thing that struck me from all the conversations I had with them was how people's lives were shaped by the values-based choices they made, such as one parent's resignation because the industry they were in didn't fit with their values, and another parent's passion for ecology, leading her to go back to university to be able to have a future influence in this area. You and we all have made a choice to be at this event today. Nobody knows how that choice will play out, but we hope that this coming together today is the start of a shared and successful journey together. Over the next few minutes, I aim to use this why, how, and what organizational model to introduce the Hindu Medical Association. To prevent overlap with Kanchanji, who's presenting later on about the what we do, I'll stick to the why and how. I thought this model was very applicable to this introductory talk, as when we were thinking about setting up the Hindu Medical Association, the central question we asked ourselves was why? Why should we set up this organization, and what is the need? Before I discuss this, I think it would be good to briefly mention that the committee is formed of doctors at all levels, including medical students, working both in the community and hospitals, and, as can be seen from the highlighted areas on the map, we're from various parts of the UK. For example, Manishji is in Winchester, Priyaji and Anandji are in London, Yogishji is from Cambridge, Madhuji from Warwick, Divyaji from Stoke-on-Trent, Kanchanji from Leeds, and finally Vinayji from Newcastle. Now, this isn't everyone that's contributed to, but I hope that it gives a flavor of who we are. I think it's important to note here that although we're launching this as an organization for Hindu medics, we have also discussed having membership from or links to other healthcare professional groups, such as dentists, doctors, and pharmacists. However, as the HMA is just starting, we felt we should concentrate our efforts on an organization for Hindu doctors in the first instance. So going back to the why. In these early discussions, what we as a committee had in common was that we felt the Hindu approach to life had a great deal to offer us as individuals, as a medical community, in our workplaces, and to health management. We therefore felt we should have a way of bringing Hindu doctors together to discuss matters affecting or important to them, making a dharmic contribution and representation to the healthcare environment, providing a forum to explore Hindu ideas relevant to healthcare, highlighting good work that is already being done by people like you in our audience to see if we can replicate it in other places, such as sustainability or well-being projects, coordinating our efforts, such as voluntary work opportunities, and providing points of contact as a resource for students or young doctors. To set our organization in context, we wanted to find out how many Hindu doctors there are working in the UK. However, this isn't straightforward due to the fact that there is no data on faith background which is obviously a problem for an organization like ours that is trying to accurately identify the issues and accomplishments of Hindu doctors. Nevertheless, we went ahead and had to make estimates based on ethnicity data. So from NHS and GMC data, we estimate that there are at least 20,000 Hindu doctors working in the UK, and this equates to approximately 10 to 15% of the medical workforce, which is significant. So who is representing these Hindu doctors? Well, although there are many organizations representing doctors from various countries, such as India and Nepal, and there are other organizations representing wider groups, such as the BAME network, there is no UK medical organization representing the Hindu perspective of Hindu doctors, or for that matter, healthcare workers of any kind. In contrast, most other major religions have a medical organization in the UK, including Christian, Islamic, Jewish, and Sikh associations. Therefore, we felt there was a clear need to address this. One illustration I can give of this is that at the time our discussions were ongoing about the creation of the Hindu Medical Association, the British Medical Association had a webinar on faith identity and working as a doctor. In this webinar, major faith groups were represented by speakers, with the notable absence of a Hindu representative, further cementing, in our view, the need to create an organization that can provide a voice for Hindu doctors. Another issue that arose during our discussions was the variability of Hindu chaplaincy services and Hindu prayer facilities within the NHS. For example, there are some hospitals with these facilities, but many without. As a national body, we felt that we could advocate for these facilities across the NHS. Kanchanji will expand more on the ideas we have for the future, so I'll move on to the how, or how the HMA will carry out its activities. Well, it's the principles of the HMA that will govern what we do. So what are these principles? I'll use the logo to explain this, as it illustrates them well. Here's the logo. The central picture is of two hands holding the kalash of Dhanvantri, which contains the health-giving nectar. This represents that we are an organization that wishes to promote health and well-being of all, including healthcare professionals and the public. The connect, nurture, inform motto is also very important. We wish to connect people on a professional and social level, as we believe the core of the Hindu Medical Association will be the community that we develop and become. In other words, you and we all, whoever is engaged, will contribute to the development of this organization. We want to nurture relationships between individuals, communities, and organizations, as it is these relationships that will facilitate and enable us to carry out our work. For example, this could include local or regional HMA chapters, working with similar professional organizations or NHS organizations at local, regional, and national levels. And we want to inform of Hindu approaches and accomplishments with evidence where it's available. As Hindu healthcare professionals, we feel that we are in an ideal position whereby we can champion both modern medicine and alternative medicine approaches to health and well-being. A perfect example of this is the keynote lecture being given today by Indranilji. And then finally, central to all these principles is the connection to Hindu Dharma, represented by the Om. So I'll stop there, as this leads us nicely onto the keynote lecture. And following this, many doctors have been asking when they hear about the Hindu Medical Association, what is it that we do? Well, you'll be hearing from Kanchanji later, who will be discussing this when she speaks about the roadmap for the future. Thank you very much.